Thank you, Mr. President. I'd like to ask the Minister for Health and Social Care, pursuant to his statement on the 15th of May 2018, if he will provide an update on the breast clinic assessments and the outcomes of the investigation.
Calling the Minister to reply, Mr. Ashford.
Thank you, Mr. President. Each case was investigated separately and the outcomes were acted on appropriately as required. The following was the breakdown of the outcomes. One individual was reassessed in their local hospital off Ireland because they were now living off Ireland. 21 individuals were discharged following reassessment. 2 individuals were not contactable despite all efforts to do so and were untraceable. 1 individual, although contacted, declined the reassessment. And 1 ductal carcinoma in situ was found, and that individual is now on a 5-year follow-up.
Supplementary, Mr. Hooper.
Thank you very much, Mr. President. When the Minister gave his original statement, he commented there is a lot of focus on the governance of the health service and the quality standards, and that the service that was provided in this instance fell well below the expected standards of Nobles Hospital. Can I ask him what the outcome of his review into the causes of this issue were, and if you'll be able to share that information with members of Tynwald?
Reply, sir.
Thank you, Mr. President. The Honourable Member has quoted me correctly as to what I said at the time. It did fall way below the standards that we should quite rightly expect. In relation to that, there's several pieces of work that are still ongoing. We've now identified a clinical lead to actually lead on Ireland in relation to breast care. We're also engaging with the Nightingale Centre to change the way that we actually do the processing of the scans and also the double check that is now in place as well. And we're also looking to appoint a breast screening programme director in order to monitor performance and benchmark our performance against the North West as well. We're also working with the Nightingale Centre in relation to cover for local radiologists to ensure that things can be sped up. So there is a lot of work streams still ongoing, but there is a full review in place, and we have got to ensure that what, as far as I'm concerned, was a never event, never happens again.
Supplementary, Ms. Sedge.
Thank you, Mr. President. Can the Minister just confirm the numbers that were recalled, please? I'd just like to seek some clarification on that. And also, he's just commented that there is a full review going ahead. Can he give us a date for completion of that review?
Reply, sir.
Thank you, Mr. President. By my maths, it's 26 individuals. Just to give the background again to the Ombudsman Court, because obviously it's been a while since we last discussed this, when we discovered that there was an issue with people who've been seen by the individual radiologist, initially it was 6 cases identified. Then the review widened out. And we looked at records of 134 patients who'd undergone breast screening investigations with that particular doctor. None of those cases were then classified as requiring further assessment, but to make sure that we were confident that no other patients were affected, we widened the review out, and in total we looked at 1,213 cases. After those cases were assessed, it was then decided that there was 26 individuals that we needed to get back in to have reassessment, either because of things that had happened afterwards or there was things that we wanted to follow up, and that was the breakdown that I just gave before.
Honourable Member, Mr. Hooper.
Thank you, Mr. President. I was actually rising to ask the same question my honourable colleague from Uncan just asked, is when is the Minister expecting the full review to be complete? In his original statement, he did say that where possible and without compromising patient data and safety, that they would publish the results of that review. So it's just an absolute confirmation when that's going to happen.
Minister.
Thank you, Mr. President. I'm happy to give it in written format, but the bits that we can publish, having spoken to the hospital, because of patient confidentiality, is the figures that I've given today. So if members want it circulated in writing, I can do that, but that is the extent to which that we can publish the patient data. If the Ombudsman member is referring to the wider review in terms of the procedures and everything else, which I assume he is from him nodding at me, then I will undertake to make sure that is circulated to members as well, after speaking to the relevant section.
Honourable Member Mrs. Beecroft.
Thank you, Mr. President. The Minister mentioned about benchmarking with the North West. I'm just wondering if he can confirm when that benchmarking commenced.
Reply, sir.
Thank you, Mr. President. I said that's one of the things that we're working towards. It's not commenced yet because we are engaging with the Nightingale Centre, and we are looking at the appointment of a breast screening programme director. That position hasn't yet been appointed to, but once it has, then we can start undertaking the benchmarking.
Final supplementary, Miss Edge.
Thank you, Mr. President. Can the Minister confirm that all patients were actually notified? So there was 134 from the original, and then he said he followed up 1,213. Were all of the patients notified and aware that they were getting reviewed, or was it only the 26 that were recalled?
Minister.
Thank you, Mr. President. The Honourable Member for Runcorn might recall, but like I say, it's 12 months, over 12 months on now, that at the time we wrote to everyone. So on the morning that I did the members' briefing to inform members and then got the press in, the letters had gone out the previous day by the post office to ensure that people received them the same morning. So all those affected by a review were written to. In most cases, in fact the overwhelming majority of cases, it was a letter of reassurance to say that there was nothing wrong, but obviously with the news story going out there, we didn't want people sat wondering if they were involved.